and catch up.
We are
Okay.
ready.
All right, the County of Passaic Board of County Commissioners meeting for May 11th, 2021 will now come to order. May I have a roll call, please?
County Commissioners, Actor,
Here.
Bartlett, Fast,
Here.
Duffy is here.
I'm sorry, I was getting feedback, so I closed my door. Duffy,
Here.
Lazara,
Here.
James,
Here.
Deputy Director Lepore.
Here. Announcement of the open public meeting law.
Ladies and gentlemen, the notice requirement of the Open Public Meetings Law has been satisfied with respect to this meeting, specifying the time, date, and location, including the annual notice adopted at the reorganization meeting, filed with the county clerk, posted in the administration building, and mailed to 2 newspapers in accordance with the provisions of the law.
Please stand for the invocation and the Pledge of Allegiance.
O God, who provides for thy people by thy power and rules over them in love, be gracious enough to bless thy servants, our county commissioners in this county of Passaic, that thy people may dwell in peace and safety through our Lord. Amen.
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 I'm on a video.
Commissioner Duffy.
I pledge allegiance
To the flag
of the United
States of America and to the republic
For which it stands,
one nation under God, indivisible, with liberty and justice for all.
Thank you, Director.
Please have a moment of silence for the men and women who have died while serving the United States Armed Forces and all who have died from the COVID-19, especially the 1,677 plus residents of Passaic County. Thank you. All right, I'll take a motion to approve the minutes of April 27th, 2021.
I'll move it.
Moved by Deputy Director James,
I'll second it.
second by Commissioner Lazara. Roll call. Roll call.
County Commissioners Actor,
Yes.
Bartlett, Best,
Yes.
Duffy,
Abstain.
Lazara,
Abstain.
Deputy Director James,
Yes.
Director Lepore.
Yes.
I
we have
believe County Commissioner Bartlett is on, but he's not connected.
He should be. He should be.
Okay, he is, okay, we got him. All right, thank you.
Let the record show that Commissioner Bartlett is connected.
That's right.
Yes.
All right. Approval of the proclamation. The Passaic County Board of County Commissioners hereby publicly recognizes May 2021 as Mental Health Month in the County of Passaic. Commissioner Lazara, would you be so kind as to read it into the record?
I sure will. Whereas mental health is essential to everyone's overall health and well-being, and whereas 1 in 5 people will experience mental illness throughout the course of their lifetimes, and whereas everyone will face challenges that can and will affect their mental health, and whereas the COVID-19 pandemic has had a profound impact on the mental health of people of all ages. Whereas it is critical to reduce the stigma around mental health struggles because that stigma often prevents individuals from seeking help. Whereas prevention is an effective way to reduce the burden of mental health conditions. Whereas there are practical tools that all people can use to improve their mental health and increase resiliency. Whereas mental health conditions are real and prevalent in our nation. And whereas with effective treatment, those individuals with mental health conditions can recover and lead full, productive lives. And whereas each business, school, government agency, healthcare provider, organization, and citizens share the burden of mental health problems and has a responsibility to promote mental wellness and support prevention and treatment efforts. Now, therefore, be it proclaimed by the County of Passaic of County Commissioners that it hereby publicly recognizes May 2021 as Mental Health Month in Passaic County. The Board of County Commissioners also calls upon the citizens, government agencies, public and private institutions, businesses, and schools in Passaic County to commit our community to increasing awareness and understanding of mental health. The steps our citizens can take to protect their mental health, eliminate stigma associated with mental health conditions, and support the need for appropriate and accessible services for all people with mental health conditions. And that's a whole.
Thank you, Commissioner. All right, now we'll move on to the administrator's report.
Director, can we vote on the approval of the proclamations, please?
I apologize. Thank you very much for paying attention. I'll take a motion on the approval of this proclamation.
So moved.
Motion
Second.
made by Commissioner Bartlett, second by Commissioner Octor. Roll
Sure.
call. Close enough.
County Commissioners Octor,
Yes.
Bartlett,
Yes.
Best,
Yes.
Duffy. We'll go with a yes. Lazara,
Yes.
Deputy Director James,
Yes.
Director Lapore.
Yes. Now we'll move on to the administrator's report.
Deja vu. Thank you, Director. We have with us this evening Jennifer Papa. Nice to see you, Jennifer. Hope all is well. To talk about from City Green, to talk about our award ceremony for the City Green Dig-In. So Jennifer, I'll turn it over to you.
Sure, it's really nice to see all of you guys. It's been a long time. I just want to start out by saying it's the spring cycle of our Dig-In award for grants for the Community Garden program. And I want to point out that the true value of this program really came to light during the pandemic. People were able to still garden. They were outdoors. It was safe for them to do so. And they were able to grow food that was really important for their families. And also the Weaselbrook Community Garden, although we couldn't open it to the public last year, City Green was able to use all of those raised beds to grow food that we donated to pantries in Passaic County. So it really served an essential component to getting healthy food to people in a really rough time. So we are really excited that this past Saturday, we did launch the Weaselbrook Community Garden for community members, and we have all of the beds, portions to people in the neighborhood and people from the surrounding communities who are going to be gardening there. We saw Commissioner Lazara there, and it was really exciting to see her in person and have her as a part of that. So I wanted to take this opportunity to thank you, County Commissioners, for continuing to support this important program. It's really affecting hundreds of people throughout the county, and I'm going to throw it over to Jenny Schrum, who's our Director of Programming, and who will describe the awards that we're giving out during this grant cycle. Thank you.
Hi, everyone. Nice to see you via WebEx. So I think we're going to bring up a slideshow, I think. There we go. All right. So we're excited to launch the Spring 2021 Dig-In program, and everyone will start gardening in the next week or two. It's the perfect time. So we can go to the next slide. So this is just a short summary of some numbers from 2014 to 2020 for the whole program, with 14 participating municipalities, 76 community gardens, 22 pollinator gardens, and I think it's a little over 22,000 daffodils bulbs that have been planted throughout the county. Next slide. All right, so now we're going to go into the awards for the spring, and there's 3 categories that we have. So first is the new community garden. So these are groups that are starting a brand new garden in a space. So first is Oasis, a haven for women and children. Next is Passaic County Community College, the Islamic Center of Passaic County, and the Palestinian American Community Center. And these are returning community gardens. So from the beginning of the program, these have all participated at different times throughout the years. And they're coming to get additional funding that they'll utilize in their garden space this spring and summer. So that'll include Ringwood Community Garden, Passaic Neighborhood Center for Women, St. Peter's Haven, Sprouting Totowa, Father English Food Pantry Garden of CFCS, the New Hope Community Ministries, Organic Villagers at Veterans Garden, and the Preakness Bible Church and Federation Apartments. And next is the Pollinator Gardens. So they'll be receiving a package of plants that will attract pollinators that are native to the area. That'll support the space, which also includes Oasis, a haven for women and children, Juvenile Education and Awareness Project, Friends of Garrett Mountain Reservation, and the Bug Family Community Organization. So thank you again. We're very excited to kick off the growing season, and we're looking forward to welcoming the groups this Thursday at City Green and Clifton to sign the grant agreements and award checks so they can start putting the money to good use and kicking off the season. So thanks again.
All right. Well, thank you very much. This has been a great partnership and a really successful program that you guys are running. So we're very thankful for that. Director, we could open up for questions if you wish. You're on mute, Director.
Let's try it again.
There you go.
Just want to acknowledge, has it really been 7 years since the beginning of this program? Time flies when you're having fun. I also want to acknowledge Commissioner Best, who, along with the rest of the commissioners, took point on support for this effort. TJ, you got anything you want to add to that?
No, just I couldn't be more proud of this program. It's impacting the communities. It's definitely having the results that we wanted it to. We're trying to find a way to take this micro grant program and really have small nonprofits, churches, community groups, senior citizen homes all take a part in getting out and enjoying nature and benefiting from our open space tax credit. And our open space tax. And this is exactly what we wanted it to be. I think we set a goal for 100 gardens and it looks like we're almost there. I
knew you were going to call out that number.
We're close. Jen, you're doing an amazing job.
We're working on it. Yeah. But I would like to say the gardens we do have been sustained for many years of the program. So they're solid. And yeah, we're really working on that 100 number.
And by the way, if anyone has a chance to visit the Veterans Garden, I mean, they grow like the biggest like vegetables ever. Like we should do a contest of like who could grow the biggest zucchinis, and like it's amazing. So
the Veterans Garden, we have an amazing aerial shot of that because it's right between the railroad tracks there, running right through the center of Patterson and like some auto body yard. And there's, from the aerial shot, it's this incredible green space, and they even have fruit trees, pear and apple trees in there. It's amazing. Yeah. And like, to your point about declaring May as Mental Health Month, the veterans and Federation Apartments and so many of our partners really talk about the meaning of this beyond the vegetables. They can really take solace in the project, and it's really a therapeutic activity, and it gets people outside. It has so many additional benefits.
I also want to congratulate Jen for the great work that you guys are doing. Just keep it up. Your enthusiasm and your passion for the whole effort speaks volumes of the kind of people that you are.
We appreciate that.
Anybody else have any comment?
I just want to say your newest garden in Clifton is amazing. How many beds do you actually have there? Because it's so big.
I think there's 25.
Yeah, I was gonna say 25 or 26.
And the fruit trees that you planted and the work that our Parks Department did in unison with you, it's just a tremendous garden. And TJ, I have been to the veterans one, and I went home and made them zucchini bread. So Michelle reached out to me on a veterans call the other day and said they're waiting for me to come back and make more. So we'll be going back there looking for the zucchini.
They have an amazing space.
All righty. Anyone else?
Okay.
Okay.
Jennifer and Jenny, thank you for taking the time to be with us this evening, and thanks for all the great work.
Thank you for the opportunity and thank you for the support.
Okay, be safe.
Thank you.
Okay, Director, then we have with us, of course, our health officer, Dr. Gungill, to give us our COVID-19 update.
Good evening, everyone.
Good evening.
We're still here during COVID. Whenever Micah is ready. Yay. Okay. Next slide, Micah. So this is 423 days. The good thing about this slide, which you cannot see, is that 2 weeks ago.
I'm sorry, Dr. Gungill, if I may. Micah just sent me a text that someone had raised their hand and I think wanted to talk with regards to the city green.
Sure.
Would it be okay if Micah opens up the? Yes. Yes, Micah, you want to allow Sister Sullivan?
Yep. Ma'am, you are present on the call. I know you had your hand up. You can unmute yourself and feel free to make a comment.
To say that we are grateful at the Father English Community Center for what you've done. And last year, although we couldn't open the garden because we had to use all the volunteers in the food pantry, we did do a program with our youth that we gave them buckets. We taught them how to plant plants. We did Zooms with them and they grew everything at home. So they continue to participate in this. And we're grateful for that opportunity. Thank you.
Thank you, Sister. Okay. I apologize for that.
Okay, so as I was saying, on April 27th, we actually had gone up by over 3,000 cases. So you can see a dramatic difference here from the first line where it was showing that we went up 854 cases from April 26th to today. We also did not increase in variants, and we're looking at, the state is looking at the variant that is circulating in India right now. We don't have any cases in Passaic County. Next slide, please. All right, so deaths increased from last time to 35 more people, more residents of Passaic County lost their lives to COVID. Regarding hospitalizations, that has gone down dramatically as well, by about 50% from last time I presented to you. The daily positivity rate, which right now is 5.47, that went down 3.59% in the last 2 weeks. And we have not had a case of multi-system inflammatory syndrome for about a month in Passaic County. Next slide, please. This is our epi curve, and we're hoping that, and you can see on the far right, that we're seeing a lot less cases in Passaic County, and we can attribute that to, you know, perhaps more people getting vaccinated, less people getting sick, and also one of the indicators is also less people getting tested, perhaps because they were not exposed. Next slide, please. This is what the positivity looks like, and I mentioned to you it's 5.47 as of today. Next slide. This is a kind of a busy slide, but I'll just tell you what I try to put out on this slide. So this is regarding the vaccination program that Passaic County is running. So on your left, it shows the number of first doses of fully vaccinated people and the total doses that we have administered, which is 54,399. just under 6,000 doses between now and April 26th, which was the last time I presented to you. Under that, you can see we're still reaching Passaic County residents. 83% of the people that we are serving at our clinic are from Passaic County. To the bottom right of that, you're seeing that this is an important metrics that the state is looking at, and that is the second dose adherence. The state is saying we need to be at least 90%, and you could see Passaic County is at 94%. So that means that people who got their first doses came back, 94% of them came back for their second doses from us. Next slide, please. All right, this is again breakdown of our clinics by race and ethnicity. That's an important, again, data metrics for the state. And you can see here on your left, we're trying to increase the Black or African American population, and we actually went up 0.3% from last time. Last time we were 3.7%, now we're 4%. And that is at our clinic that we're doing, which is different than, you know, everybody else together. Next slide, please. All right, this is again a little bit busy, but I just wanted to show you graphically of all of the clinics that we have had. This slide shows the number of people we vaccinated at those clinics. So you can see on April 15th, we vaccinated our most, and that was 1,962 vaccines. And so you can see after that 1,700, 415, and then you see the numbers start to decline. Like it plummeted first, 548, and then the decline, and that was around the time, I believe 413 or 415 is when the Johnson & Johnson vaccine was taken off the market. So the hesitancy and so forth affected the number of people who were being vaccinated at our clinic. Of course, there are other variables as well, which would include more availability of vaccines and so forth. But all throughout the state and the country, there is a definite plummet in number of vaccines administered right after the J&J was removed from the market. Next slide, please. Another way of looking at the vaccination at our clinics, this is showing the blue is showing the first dose, the red is showing the second dose, and the green is the total. So as you can see, we're really making a difference. And again, just before the J&J was taken off the market, you can see we were we were vaccinating a tremendous amount of people in our clinic. Next slide, please. All right, so this is overall for Passaic County. This includes all vaccinators. This is a breakdown by gender, race, and ethnicity, and overall data. So right in the center, you can see that, and this is from the CDRSS, the state website, 375,000+ doses were administered, and that's first and second doses. You can see to the right of that by age group that we are the 30 to 49 age group and 50 to 64 are mostly are the ones that are mostly getting vaccinated. And a huge part of that reason is that that's the working age people. But I'm also very proud that we're getting a large percentage of our 80 plus age group. At the bottom right, this is a breakdown again for the entire county of Passaic with all of the vaccinators included. And you can see here that for the subpopulations that we're trying to reach, such as the Black and Hispanic populations, overall in Passaic County, 5% of the Black population is being vaccinated. Of the Hispanic population, about 25%, and so forth. All right, next slide, please. All right, again, a little bit busy, but I know a lot of people want to know about their own municipality. So on your left is the data from April 22nd, and on your right is the most recent data that we were that we have of vaccinations throughout Passaic County. So as you can see, the first column is the municipality. The second is at least one dose received, and that could be one Pfizer, one Moderna, one J&J. The third column, percent course completed, means that if it's a 2-course vaccine, they finished it, but it also includes the 1-course vaccine. And the very last column is people with at least one dose, the raw number of people and not the percentage for that municipality. And so the column number 2, are we going to compare number 2 from April 22nd, number 2 from May 7th. Let's take Bloomingdale. And we're looking at this column because this is a column that the feds are looking at, the state is looking at, because there is some level of protection even if a person has taken one dose of the vaccine. So on April 27th, you can see that from the eligible residents of Bloomingdale, 54% of that eligible population had received one dose of the COVID-19 vaccine. As of May 7th, that number went to 60%. Let's pick North Hill then, 62% on April 22nd. On May 7th, 65%. One of the more, West Milford, for example, 51% on April 22nd, and they're up to 57% as of May 7th. And obviously it means different things in terms of raw numbers. So if you compare the raw data, you can see that West Milford on April 22nd, 10,485 people had at least one dose, whereas May 7th, 11,674. So over 1,000 people, but it moved up by about 6 percentage points. So we're looking at that second column, the one that begins with Bloomingdale at 60%, and that's the one we're really pushing for to get them to that 100% of their eligible population. All right, next slide, please. All right, so how are we doing with our goal? We are about 63% towards the goal of 267,000 people being vaccinated. So, obviously we knew we were going to slow down, but I think that we slowed down a little bit earlier than we expected because of the pause in the J&J administration of this vaccine. But we're cranking it out. We're trying to do everything we can. We're doing the homebound visits. We have created the hybrid on all the places that we're testing. We're vaccinating. We're working with our business partners to identify who wants a vaccine, and we're trying to meet those needs. And this is everywhere. In Patterson, they have evening hours. They're on the road with their RV. Everyone is really buckling down to try to get to where we need to go to protect our residents. Next slide, please. And, just a reminder for people who are not vaccinated, the vaccines are safe. It is the most effective way right now that we could protect ourselves and our loved ones. And they're everywhere. So please, if you're on this call, make your appointment. Get your vaccine, walk into one of our clinics. We're taking walk-ins at this time. And that, ladies and gentlemen, is my overview of COVID-19 as of now.
I have a question, Charlene.
Sure.
On the number, so we're looking to vaccinate 267,000 residents.
Yeah.
And when we look at the total number of residents in Passaic County, are we looking at just those 18 and over, or like we have over 500,000 people in the county? So is the number we're using including kids or not including kids?
No, so that number is a number of 18-year-olds and above.
Okay.
Because initially all the vaccines are only approved for adults. And that includes obviously with the Pfizer vaccine, 16-year-olds. I don't believe when I did the calculations initially that I had included 16-year-olds because at that time it was only 18-year-olds.
Okay, but the Passaic County population we're looking at are just adults 18 and above.
Correct.
Thank you.
Welcome.
Director, if I could ask a couple questions. Dr. Gunghill, I believe you said the second dose rate is 94% successful in terms of people coming back for their second dose. Is that the correct number?
I believe that's the correct number.
Yeah.
Or approximately. But
Approximately.
I'm seeing on the individual town by town breakdowns, there's a pretty large discrepancy between one dose versus completed course. Is that simply because people have just not gotten their second dose yet, but we expect them to? So are we confident that whatever that first dose rate is, that we should have about 94% of that is kind of the true number of people who are vaccinated in those towns? Is that, like, I'm looking at Patterson, it's saying something like a 40% to 23% split. Are we more confident in that 40% number or in that 23% number in terms of those that are truly, going to get fully vaccinated? If you understand what I'm saying.
So this data is actually not available to us. This is the data we received from the state. And they're saying from all of the vaccinators in Passaic County that this is how Passaic County by municipality is ranked. It's showing that people are coming back. About 94% of people are coming back for their second doses. I believe that's the data you're referring to. Let me look at my notes here. Is that what you're referring to, Commissioner?
That was the first stat. Yeah, the 94% was something you had just stated in an earlier slide, and then the town by town breakdowns. It just seemed like it was between the first dose and a completed course, right? It was much more. It was like almost in half, or slightly more than half. So my question is just: is that smaller number, like for example for Patterson, where it's about 40% have at least one dose, but only 23% have done a completed course? Are we confident that 23% is really closer to 40%? They just haven't gotten the second dose yet. They're still in the queue or whatever. They haven't they haven't come in that second dose yet.
Okay, so I think what we're doing is looking at apples and oranges. The 94% from that slide, that is Passaic County as a county, what we're doing, what we're submitting to NJIAS after
You're saying what we're doing only from our Passaic County sites. Is that what you're saying?
That's 94%.
Got it.
The other number that you're looking at is a number that represents all vaccinations throughout the county. So it's St. Joe's, it's St. Mary's, it's the Passaic County Health, it's Wayne Health, it's everyone.
Sure. Yeah, I'm just trying to understand which is more representative of how far we've come or haven't come in some of these municipalities. Are we closer to that first number or that second number? I guess the answer is we don't completely know. The answer is probably somewhere between.
So I think that this data piece that you're referring to, I think that we are probably closer to the larger number, because what they're doing is the difference between the at least one dose and the course completed are people who have initiated their vaccine, and they're hoping that they will finish it. Does that make sense?
No, that does make sense. I appreciate the clarification. I have another question, but I'll yield to somebody else who has if there's someone else. I thought Commissioner Bartlett might have something to say.
Yeah, thanks, Asad. You can finish if you'd like, or we can.
Just quickly, I don't know if you have information on this. I know the FDA gave a partial approval for vaccines for 12 to 15-year-olds. I don't know if we're able to release any details, but preliminarily, do you have are we changing your procedures or have any different plan for when, teenagers are able to get, immunized.
So the health officers and I are talking about that, what that's going to look like for us. But yeah, absolutely right. The FDA has approved it. The CDC, I believe, I'm not sure if they did that today while I was here, but once the CDC does, then the CDC will work with us as far as how that's going to be distributed. And I think part of the conversation will be if everyone is capable of managing the Pfizer vaccine. It is a lot more specialized and has some, particular needs that everyone may not be able to manage, proper storage and handling and so forth. But we're talking about that. We're talking about whether we, how are we going to work with the Board of Education? Where will we be doing vaccines? And it's a good thing, but it also adds some more dimension to what we're doing, because that 267,000 people, that number is going to change dramatically in terms of, are we going to have herd immunity when we add another tremendous population, which is the 12 to 15-year-olds. So there's a lot going on right now. I think in public health, we just adapt to what is happening, and we'll just make, those decisions when that time comes, as far as how are we going to do it, and we'll get it done, because that's what we do in public health.
Well, you've been getting it done, so we appreciate it. Thank you for your time.
Yeah, I second that. And actually, Assad's question was one of mine, which was with Pfizer. I know we have the capacity to store it, but we so far haven't been using it because we've been getting Moderna and J&J through the state. I was interested in sort of a pair of questions. One is, if we get it, are we ready? And the second is, how are we going to, if not, what can we do, whether maybe it's just an additional link on our website to make sure that people know that they can go to places like St. Joe's in both Patterson and Wayne to get the Pfizer vaccine. And then my other question was also about this tougher challenge that we have now of getting it out there to the people that aren't going to come to Modell's for it, or maybe even aren't going to come to the community college for it. Of course, New Jersey has a shot and a beer, a shot and fill in the blank. What a shot and a prayer? Are we, should we be at masjids and mandirs and churches? What else can we be doing? It seems to me that we're getting more time intensive now, because we've got to go to the populations that still need the shots. And I guess I'd like to hear what are your plans and strategies for that in the weeks ahead.
So we're actually working with our faith-based groups. As a matter of fact, I just got another contact with Williams Chapel in AME Zion Church in Passaic City. They have expressed an interest in holding a clinic. I believe on the 18th, I have someone talking to a number of churches regarding vaccine hesitancy, because I think part of our conversation has to be, jumping over the hurdle of explaining to people about the vaccines and the benefits of vaccines as opposed to no vaccines. And so we're working with faith-based. I do have a number of somebody, the imam at the ICPC, I believe. Actually, I received that number a couple of days ago. I have not called yet. Tomorrow we will be at the Micases Puebla in Passaic City. We were invited to go there. The State Department of Health called us up to work with the Passaic City to vaccinate persons in that location. We'll be there tomorrow.
Is that a walk-in site?
Yes.
Okay. What are the hours?
9 to 1. 9 to 1.
I didn't mean to interrupt, but and I don't know. I'd kind of defer to Assad on this, but I know that Eid is Thursday, I believe, and whether
that would be a time that we either should be working with masjids to get shots out, or at least working with masjids on the outreach piece of this.
So I have she used to be my one of my contact tracers, and she has actually been working with a communicable disease program that I initiated. And part of what she has done is she has visited that site. She has brought flyers, had conversation, and we were told that after Ramadan is over, that's when they'll be willing to do this. So this has been discussed and for several weeks now.
Just on that point about Islamic centers, and I'm happy to help in any way in that, Dr. Gunghill. But I think after Ramadan is best. Obviously, that'll be ending this week. But Friday prayers are always packed, and there's lots of folks there. So any opportunities to set up mobile clinics or arrangements like that to actually give shots on Fridays, you'll have a pretty captive audience.
Okay, thank you. I also have a list of, I think I have 8 or 9 businesses right now that have reached out to us to provide vaccines, and I'm working with Vault and also with my staff, depending on how many individuals are interested to go to their sites and do the vaccines on site. So there are a lot of initiatives that we're doing right now. And it takes a while to build up steam, but I've seen an increase. For example, we were in Wanacue today at the testing site, and last week I believe we only had 9 people take the vaccine, but today we had 17 people. So it might not be a lot. Yeah, it's 17. It might not be a lot, but it's we're making inroads, and again, a big part of it is the educational piece. So for tomorrow, for example, I have 3 Spanish-speaking staff members going to the Mexican consulate so that they could also not just give them the vaccine, but explain to them why the vaccination process is safe, and any questions they have, they will be able to answer them. And we continue with the homebound program as well.
Through you, Director. Thank you, Charlene. You've went above and beyond what anyone could have expected, and I know that as the time goes by, you'll have, you'll reach out to everybody. I know it's a daunting task. It's a lot of people, but thank you for everything you've done.
My pleasure. Thank you.
Okay, Director, that concludes my report.
For Dr. Gunghill? No one? Okay. All right, moving on. Thank you, Dr. Gunghill. Commissioner reports. I just want to start out by acknowledging the fact that despite all the challenges of operating the way we have been for the past year, the county hasn't missed a beat in delivering its services, along with the administrative team, the Board of Commissioners, and all the involvement they have, our employees, our department heads. And I'm quite proud of them all for everything that's been going on, the challenges that they face. I think Dr. Gunghill just touched on some of the issues there involving this pandemic. And so once again, Passaic County is taking the lead, I believe, in many areas throughout this pandemic, and we continue to come up with ideas to try to get more and more people vaccinated. And I applaud everyone at the county for all their participation and their efforts to that regard. All right, Director James, Deputy Director James, you have anything?
Just really quickly, we know what a good job Janice has been doing. Janice Solutions have been doing for looking at our Human Services Department. I'm just happy to report that we did an RFP for the Board of Social Services, and Jeff Pursley's group won that RFP. They're doing a special meeting on the 17th, and if any of you would like to tune into that, feel free. I'll give you the link to go there. But we're going to take a look at all of social services now for the board and bring it into compliance with what the county's doing and try to leverage what we have, our resources, to have a better view of what we do for the citizens of Passaic County. So I'm very excited about it, and I appreciate everybody's help, particularly our county administrator and our chief counsel. They have been a big help in putting all this together. So I'm looking forward to it. We'll see where it goes. But anything to improve what we do with our population, people who are in need, best bang for the buck is what we have to do. So thank you all.
Okay, Commissioner Octor, you have anything?
Thank you, Director. I just want to, Commissioner Bartlett mentioned this, but the end of Ramadan is upon us, and Eid, the holiday, Eid al-Fitr, will be celebrated on Thursday at the Islamic Center of Passaic County, and I know other mosques may sometimes, it's too complicated to explain on this, but it may occur on Wednesday or even Friday at certain mosques, so don't be surprised. But either way, Eid Mubarak to all our Muslim American constituents of Passaic County and beyond. Obviously, it's been a difficult Ramadan for all of us for a number of reasons, including this pandemic. And I know that I also want to say that we live in a very diverse county, a county with a lot of folks who have family that live abroad. And I know that there are folks who are Indian American constituents in our county who are hurting right now because of the situation in India. And I hope they will, I know it's very difficult not to travel or not to go there, but we hope they will exercise restraint and caution and everything that goes with that, but a very difficult time for them. Also for our Palestinian American constituents, you know, I'm not going to get into the politics of it, but whatever you feel, there are human beings and children whose lives are being lost on both sides of this battle. And we have many Jewish constituents who may have relatives back in Israel. And there was also a unfortunate stampede at a religious gathering in Israel only about a week ago, and there was at least one person from New Jersey who was lost in that. So it's been a difficult time for many of our constituents who have relatives and family abroad, and I hope we'll think of them during this time. Thank you.
Okay, Commissioner Bartlett.
Just very quickly, I know you all have heard me talk a little bit about the work that we're doing on eviction prevention. We are in the process, along with Janice, that Bruce mentioned, and Solic Solutions, that's our technical vendor, of rolling out a website. We had hoped to have that out yesterday. It looks like we're going to be rolling the website out for landlords and tenants early next week to start logging on and accessing that funding, which can look back as far as 12 months, look forward potentially 3 months or more, and prevent evictions by providing some amount of funding to landlords whose tenants are unable to pay the rent due to COVID, and also provide a whole host of wraparound services, including through the Board of Social Services, for tenants that receive that. So in addition to receiving the rental assistance, you may have the opportunity to connect with job training and education and job placement, and also inform yourself on things like food stamps and other sorts of aid that your family might be eligible for. We got a piece of good news yesterday, which is that above and beyond the $87 million that we received through the CARES Act, and then $97 million that we received to the county for us to determine its use through the American Rescue Plan, it looks as though we'll be receiving an additional $21 million from the federal government through the American Rescue Plan, specifically to expand and increase the eviction prevention initiative. So it's a tremendous opportunity to make sure that people have housing stability through this year and beyond, and also that landlords who are participants in our local economy have the resources that they need to do their thing. So more good news on that front, and I'll continue to keep everybody posted.
Thank you, Commissioner. Commissioner Best?
No report, sir.
Thank you. Commissioner Duffy?
I'm going to follow Commissioner Best. No report at this time. Thank you, though.
Thank you, thank you. And I'll close out by acknowledging the great work that our county clerk has done regarding the vote by mail ballots. Finally, our ballots look like or mirror the voting machines. It's linear. I applaud her for her hard work in making that happen. And I think there'll be a very positive result from that in this coming election, not only in June, but in November. Anything to make voting easier and more pleasurable and enjoyable and less confusing. So thank you very much to our county clerk for her hard work.
You missed Commissioner Lazara for comment, if she may have one.
Did I miss Commissioner Lazara?
Did you right from the
You know why? Wait. She's on the second page. I missed.
No, I'm good. I don't have anything. Thank you.
Thank you very much. No communications at this time. I'll take a motion to open the public portion of the meeting.
That motion.
Motion made by Commissioner Duffy. Need a
I'll
second?
second it.
Second by Deputy Director James. Roll call.
County Commissioners Octor,
Yes.
Bartlett,
Yes.
Best,
Yes.
Duffy,
Yes.
Zara,
Yes.
Deputy Director James,
Yes.
Director Lapore.
Yes. At this time, I'll turn it over to you, Lou.
Micah, does anybody have their hands raised that want to speak?
The only hand that's raised is from earlier, and that's just one count. We have no other hands raised. I have no messages in chat or in the Q&A.
I do have I do have a email at Passaic County or at public at Passaic County NJ, and it reads, "Good day. The county signage at the COVID vaccination site in Woodland Park, Modell's, caused me not to get my vaccination on April 30th. The signage posted amid a very heavy police presence told visitors to wait in their vehicles until informed to approach the center, park, and wait to be called on. I have attached photos of the signage in question. There is no indication of how we'd be told when it was okay to approach the center. Telephone call, phone, text, smoke signal, skywriting. I dutifully waited in my car for 30 minutes, nothing. Apparently, the only way to know if it's okay to approach the center was to disregard the very signage posted by these police officers and asked if it was okay to approach. Call me crazy, but I don't feel comfortable having to approach people with guns after they put up a sign telling me not to do so. Then further trust them to put hastily approved vaccine in my body. The relief I seek is disevaluate signage at the site, reduce police presence at the site. I shouldn't have to approach someone with a gun to get a vaccine. Signed, Derek Fenton, Bloomingdale, New Jersey.
You have anything else, Lou?
I do not have anything else, Director.
I'll take a motion to close the public portion.
I'll move to close.
Second.
Moved by James, second by Duffy. Roll call.
County Commissioners Octor,
Yes.
Bartlett,
Yes.
Best,
Yes.
Duffy. Yes. Lazara,
Yes.
Deputy Director James,
Yes.
Director Lapore.
Yes. Do we have any late starters, county council? For the
Director, there's
consent
no
agenda?
late starters, no need for executive session. Just a reminder, if anything needs to be removed from the consent agenda, to make that motion through you.
Yeah, we're not doing that.
Okay, I'll take a motion on the consent agenda.
I'll move it.
Moved by
Second.
Commissioner Lazara, second by
Second.
Deputy Director James. Roll call.
Just for the record, Director, that's L1 through L38.
Yes, it is.
Thank you.
County Commissioners Actor,
Yes.
Bartlett,
Yes.
Best,
Yes.
Duffy,
Yes.
Lazara,
Yes.
Deputy Director James,
Yes.
Director Lapore.
Yes. On the new business, motion on personnel,
Move the personnel agenda.
moved by Deputy Director James, second by Commissioner Lazara. Roll call.
County Commissioners Actor,
Yes.
Bartlett,
Yes.
Best,
Yes.
Duffy.
Yes.
Lazara,
Yes.
Deputy Director James,
Yes.
Director Lapore.
Yes. Take a motion on the bills,
Move the bills list.
moved by
Second.
Deputy Director James, second by Commissioner Lazara. Roll call.
County Commissioners Actor,
Yes.
Bartlett,
Yes.
Best,
Yes.
Duffy,
Yes.
Lazara,
Yes.
Deputy Director James,
Yes.
Director Lapore.
Yes. Seeing no reason to continue, I'll take a motion to adjourn.
So moved.
Moved by
Second.
Deputy Director James, second by Commissioner Lazara. Roll call.
County Commissioners Actor,
Yes.
Bartlett,
Yes.
Best,
God bless America. Yes.
Duffy,
Yes.
Lazara,
Yes.
Deputy Director James,
Yes.
Director Lapore.
Yes. Thank you and good evening, Commissioners.
Good night, guys.
Thank
Good
you.
night.
Bye, guys.